fixing healthcare from the trenches. And it's going to have to come from the trenches. It is not coming from DC. There's some problems going on there right now as we speak. It's not going to come from the insurance companies. It has to come from the people delivering the care and the public.
To answer your question, three things that I think we can do. I think the biggest thing is making more of an investment in primary and preventative care. Best offense is a good defense, right? Well, the best medicine is preventive medicine.
Absolutely.
You know, you and I both are great at fixing problems once they occur. I'm diagnosing and treating the stroke once it happens. It is much cheaper to the healthcare system to prevent those problems from even happening. I think Congress has to incentivize more physicians to go into primary care. And I think a big part of that is starting with increasing their reimbursements. Medical students on average graduate with over 6 figures of debt. But for their 3 to 7 years of residency, they're only making about 50, 60K a year. So they're not really making any progress towards repaying those loans. Is it really a surprise then that physicians are choosing the specialties that reimburse better? I think if we get those two things, the third thing for us is making more of an effort to engage with our patients to get them plugged into primary care. I thought if patients just don't have primary care docs anymore and going and seeing their...
To you, right? They show up in the emergency room, which is expensive care. And
I'm good at a lot of things, but I'm not a primary care doc. We would have to really work to make a cultural shift to get patients back and engaged in the preventative aspect of medicine as opposed to the reactive phase of medical.
So harping on this is abolish authorizations. I'm going to call it oversight, not authorizations. Oversight means, of course, there are physicians who may be overutilizing, maybe occasionally doing the wrong thing. So it's okay, whether it be insurers or colleagues, medical boards, to give oversight, but to stand in the way of every decision with an authorization and approval by somebody sitting at a desk, that costs the system a lot of money. Dr.Jasani doesn't have time for authorizations. When somebody comes in, like our football player with a stopped heart, there is no chance. When somebody comes in with an open tibia fracture, like I treated at Bellevue Hospital for many years, there is no time for authorization. But yet in the private practice world, I've had people come in literally with a finger dangling from a circular saw injury in their garage, and I have to wait for one of the insurance companies to give me a little number. And of course, I don't. And what's the consequence? I do the treatment that's needed, and later on, they say, oh, doctor, we can't pay you. You didn't have prior authorization. This has to be a national push.